Hello everyone, good evening. Welcome to live session on Galactogogues, that is foods that increase breast milk supply. My name is Dr Tanima Singhal. A brief about myself. I am a doctor with 12 years experience in obs and gynae. My basic graduation is from Ayurveda field and I have my further post graduation in reproductive child and health. Since 3 years, I am practicing as a childbirth educator, lactation consultant or a counselor, and a Garbh Sanskar expert. So today's topic is basically on Galactogogues, that is the foods that helps in increasing breast milk supply. During my breastfeeding counselings, I see mothers asking this question frequently, like what foods should I eat so that my breast milk supply goes up? What should I do to increase my breast milk supply? These are the most common questions which are asked by mothers during breastfeeding counseling with me. So today I am going to give you a brief about what are galactogogues and which galactogogues can be taken by a breastfeeding mother during her to increase her breast milk supply. So first, what are galactogogues? As I already told you, galactogogues are the food substances that helps in increasing breast milk supply. It may not be only food substances because galactogogues are both natural and synthetic. Synthetic are available as medicines and natural are basically the food forms which I am going to discuss in the later part of this video. Why are they important? We have to also understand why do we need to prescribe galactogogues for breastfeeding mothers. Galactogogues sometimes play a role of placebo also. Mother's confidence is very important during the breastfeeding journey. Sometimes the galactogogues basically they help and it gives a kind of satisfaction to the breastfeeding mother that okay, something is there which she is able to take to increase her breast milk supply. So there is no harm in taking galactogogues. Galactogogues, the food substances which I am going to tell you, will always be beneficial in not only increasing her breast milk supply but also to build up the nutrition loss which a mother faces during her pregnancy and during her breastfeeding journey. Galactogogues will not only help increase her breast milk supply but also to bring up the micronutrient deficiency, that is the type 1 type 2 micronutrients which are very important for a mother to increase her stamina and to increase her and to replenish her nutrition supply which she lost during her pregnancy and breastfeeding. So now we have to understand how it is going to help a mother. So the galactogogues which the mother takes, it helps in increasing her breast milk supply. In turn, that breast milk supply when it increases and when she sees the increase in breast milk supply, her confidence boosts up. When she feels very confident of her breast milk supply, she also puts her baby frequently on the breast because she has that confidence with her that okay, now everything is okay, I have to try my best. She puts her baby frequently on the breast, and then what happens when the baby is put on breast frequently, there is a constant demand for the brain to understand the demand of the baby, which is very important for making a supply regular. So with the increased frequencies of putting the baby on the breast by a mother, the regular demand which is created will give a signal to her brain that make more milk. So that regular signal will help the brain to understand the increased demand and it will make more supply, which in turn will increase her breast milk supply, and this is a cycle. When she sees her breast milk supply, her confidence will go up and then it will keep moving. So in that way the galactogogues are very important. Now what are the types of galactogogues? There are two types of galactogogues, natural and synthetic. Synthetic are the ones which we give as the form of medications. That is the last resort when we have tried all kinds of natural galactogogues. Then sometimes we also need to go for the synthetic ones. But previously we always advise mother to take the natural galactogogues. Now, who should use the Galactogogue? It is not for every breastfeeding mother. You have to understand that. It is not for every breastfeeding mother. So you have to understand who should use it. The mother who is facing a decreased milk supply, or sometimes she is assuming that her breast milk supply is low, she can take Galactogogues, but only after consulting her lactation consultant. Okay, and also from this I reminded one thing to just let you all know that breast milk supply and these issues are to be taken up by a lactation consultant. Sometimes what happens, mothers are not knowing whom to reach. They reach out to their pediatrician or their gynecologist, but you have to understand there is a special category, that is the lactation consultant, who will help the mother to increase her breast milk supply and any other issues related to breastfeeding. So you have to understand whom to reach out for this. And also, ladies, please understand, if you are knowing any mother who is going through a breastfeeding journey, or any mother who has just delivered her baby, please make a note to ask her if her breastfeeding journey is okay. And please don't ask very direct questions, that is it okay, is the baby feeding. So please don't ask those questions. Better you can ask her that are you okay. First win her confidence. If you win her confidence, she may open up and tell you about her problems if she is facing. So that will be easier for you to understand, make her understand what you want to tell her. Now also we have to understand Galactogogues are used by mothers who are on relactation program. Relactation, what is relactation? Relactation is the process where a mother who was breastfeeding in the beginning, and without for any reason she has to stop breastfeeding, or it got the milk supply went low and she has to put the baby on formula milk, and now she wished to have her breast milk supply again back so that she can breastfeed her journey. So this is called as relactation, and I do take relactation programs also for my patients. Okay, so that is a separate topic, and I'll be taking a session on relactation also. Today we are discussing about Galactogogues. So finally, we are starting our Galactogogues list, which I am going to tell you. Please use them, so that it will help you to increase your breast milk supply. Okay, so first of all, it is fennel seeds. Fennel seeds, or it is called as saunf in Hindi. Fennel seeds, they are very good in vitamin C. Okay, and it also helps in digestion, bloating, and upset tummy. Mothers who are on breastfeeding journey, and especially after during postpartum, they always feel bloating kind of a thing in their tummy. So if you have fennel seeds, it will be good for both. It will also help your digestion and also increase your breast milk supply. How to take? You can also take them as a tea in the morning, early morning. You can just put some fennel seeds into water and let it boil. After boiling, just put a lid on that and let it cool. You can have it as warm tea, and you can put little honey into that and you can have it. Or avoid honey if you are suffering with diabetes or you had a gestational diabetes during pregnancy. You can also take directly the seeds. You can take fennel seeds or the saunf which I am talking. You can take it after your meal. Just pop it in your mouth, and that's all. That is done. Second Galactogogue is lehasun or garlic. It is like we have been listening this from our lot of old ladies, our senior persons at our home, that lehasun or the garlic is the best Galactogogue, and yes, it is. It is very good. It has proved itself that it is very good for increasing breast milk supply. Also, garlic prevents cancer, so it has some added benefits along with your increasing breast milk supply. Garlic supplementation should be taken just before nursing your baby. So before your feeds, you can take a garlic supplementation as whatever form you are having it with you. Next is Fenugreek or Methi. Methi seeds are again a very good Galactogogue. It is also rich in iron, protein, and vitamin C. So all these Galactogogues, as you can see, they have other benefits also. So this is very important for you to understand that Galactogogues will not only help you to increase your breast milk supply, but it also helps you. Now I am just seeing my younger son is, Mihit, please don't do that. So that is the thing of working from home. Today is Sunday, so I am at home. So my younger son is thinking that I am doing something. Okay, fine. So Fenugreek or Methi, as I told you, it also enhances the milk quality. Okay, so this is very important. Bring them on camera. Okay, fine. So this is fenugreek, and yes, there is a special precaution for fenugreek or methi. The people who are prone to asthma or allergies should not take methi. They have to, like, there is a precaution with methi, so you have to understand that. Next galactogogue in the list is sesame seeds or the till. Till, both white and till and black till, both are good. Now, one thing very important to note here is that you should take the crushed seeds. You should not pop directly the till. So you should crush them. Otherwise, it will pass on the digestive system without giving any benefits. So you have to crush the till seeds and then you can have them. Also, till seeds or sesame seeds are very good in calcium. So, for a breastfeeding mother, it has an additional advantage of giving calcium, a natural calcium to you in the form of till. Now, next thing is Moringa leaves. It is also called as drumsticks, which we use in our sambar, etc. So, their leaves, that plant's leaves are very important. So, that is called as Moringa leaves, and it is very rich in iron and calcium. So Moringa leaves also helps in increasing your immunity. So along with Galactogogue, it also helps in increasing your immunity. So please take Moringa leaves. It is very good Galactogogue. Also this Moringa leaves has an additional advantage that it enhances the nervous system of mother and baby. So it has that additional advantage of enhancing your nervous system. Now then we come to the group of pulses. In pulses group, your red Masoor Dal, that is very good Galactogogue. So that you can have it regular, or alternate days you can have red Masoor Dal. That is a very good Galactogogue. Next Galactogogue list is adrak or ginger. So ginger is again a very good Galactogogue, but it should not be consumed in early postpartum period because it has a tendency to create hemorrhage. So ladies who have got heavy bleeding during their childbirth delivery and also who are suffering with postpartum hemorrhage, they should not take ginger or adrak in early days. Okay. Then we have water. Okay, so now I can't emphasize more on water. Water is very, very, very important for a breastfeeding mother. At least 3 liters of water she should take every day to ensure a good breast milk supply. Now there is a tip of how she can take up water. 1 glass of water before every feed is what is important for a breastfeeding mother to ensure a good lactation. Okay. Now I just want to inform you all that we have a lactation mix which is made by Maa-Si Care Clinic, and it is 100% natural, and that can be taken by breastfeeding mothers to increase their breast milk supply. Along with you can have the details of that from clinic helpline number 860-480-3205. That is our clinic helpline number. You can contact there for lactation mix. We have free home delivery across India, and that is 100% natural, no preservatives into that, and it is made up of 25 ingredients. So it is going to help breast milk supply increase and also to help mothers to regain their stamina and to regain their nutrition back. Also, I would like to add on here, along with the Galactogogues, what is most important is good sleep, good rest, decreased anxiety. I understand for a new mother, she has lot of things in her mind of like what will happen, how will my baby get good health, and all these things. So first of all, she has to decrease her anxiety levels, and that will come only by a support system at home. Please always, this is an advice to all the family members who have a postpartum mother in their home, a mother who is breastfeeding. So a very big support system is what is required. Love and care for a postpartum mother is what I would really suggest, and if you give a good support system to a breastfeeding mother, magic will happen. She can do wonders, but you have to be a very good support system. And this is what we ensure at our clinic. So all the breastfeeding mothers, if they are watching right now or they will be watching, they will know that what kind of support system we provide to them, and that's what is expected to them to pass on to the other mothers who they come across. So on this note, I am just ending my session. Hope you all like this session. If you all like this session, please comment below, so that it motivates me to give more and to push myself more to bring more information to you all. Fine. So if you like this session, please share this video to all mothers. You can tag your mothers who are breastfeeding mothers. You can tag them so that they get this information. On this note, take care. Signing off. Bye bye.